I'm Karim Brohi. I am a consultant trauma and vascular surgeon at the Royal London Hospital in East London, which is part of Barts Health NHS Trust. I'm also a Professor of Trauma Sciences at the Centre for Trauma Sciences at Queen Mary, University of London, and the Pan-London Medical Director for the London Trauma System. And the British Journal of Surgery has asked me to record a short piece on why I became a surgeon. And I hope it's useful in some ways. I thought I would cover a few key points really around why I chose surgery. My path to surgery wasn't straightforward. I didn't always know I was going to be a surgeon by any means. So how I ended up being a surgeon, how I chose trauma surgery, and then how I guess I became a surgeon, and what it feels like to be a surgeon, and also a surgeon scientist, as also I've become over time. So in terms of why I chose surgery, so initially I wasn't surgically minded at all. I found general surgery especially very confusing at medical school and didn't do well at all in my undergraduate surgical exams, although I did enjoy my surgical rotations through orthopedics, plastics, and others. So I enjoyed being part of the surgical team, but didn't really get surgery. And I was always much more drawn to the acute medical specialties, acute internal medicine, and emergency medicine in particular. But really, when I left medical school, it was cardiology that I thought I was going to do. But as I progressed early through house jobs first, including a cardiology house job or foundation year job as they are now, it became clear to me that I probably needed or wanted a wider base to what I did, and emergency medicine became more and more attractive. And I did emergency medicine at University College London at UCH. And really it was there in my time there that I focused down on trauma as being the thing that I really wanted to focus on. And the thing that did it for me, like it is for many people, is two specific patients that I treated or was involved in at the time. I was very junior, and these two patients really brought home to me that really, things could be a lot better for trauma patients and for trauma care. There was a young man who was actually blown up in a bombing in Covent Garden, who really threw the entire trauma team into a spin. Nobody really was able to get their head around the situation, take charge, apply themselves appropriately. And another patient, somebody who was macheted in the head in Chinatown while trying to take some money out of a cash point, who I remember my registrar at the time finding lying in a trolley and identifying that he was much more unwell than other people had felt, and really understanding that it was his knowledge and his awareness that made such a big difference in that patient's pathway. And so really I felt that trauma as a disease and as it could be something where I could probably make a difference in, both to individual patients in front of me, but maybe on a wider scale. But more importantly, I think, and more selfishly, that would keep me interested and active throughout, the breadth of my career. Of course, at that time, and really maybe a little bit still now, there was no specific specialty of trauma, at least trauma general surgery. Trauma was picked up by individual specialties, often orthopedics, very fragmented. And so there wasn't an obvious path for me to do surgery, trauma surgery. or even trauma care in general. And I didn't know whether to approach it from emergency medicine, from anesthetics, and critical care, or orthopedics, whatever speciality. And I think even today, you can make valuable contributions, very valuable contributions to trauma care through any of those specialties. And so the choice of surgery was very particular to me. I think I went around first anesthetics and critical care because I knew that whatever I did, I would need a solid understanding of critical care. So I did some anesthesia and some ICU. But I was already doing my surgical exams at that point because I was pretty sure that I wanted a specialty that would take me through the breadth of the patient's journey from start all the way through to recovery. And then it was just really it was really a matter of choosing a specialty. And again, I really enjoyed orthopedics at Oxford. I did neurosurgery at the Royal London, but I eventually settled on general surgery, and especially vascular surgery, as the one that would give me the broadest breadth of, I guess, activity and acute activity across body domains in surgery, and allow me to look after patients in the post-operative phase and out in the outpatient phase of care. Of course, it's easier said than done, as always, to become a surgeon in the specialty that you want. And I was keen also to get a broad experience that would stand me in good stead. And I was not really in any rush to become a consultant. I was interested in learning and training. And so I did some time on the Helicopter Emergency Medical Service, now London's Air Ambulance in London. I went to South Africa, to Cape Town for a year, and trained at Groote Schuur, and then started my registrar training, which, like all training, you have some great jobs, you have some good jobs, you have some okay jobs, some jobs that are relevant to the thing that you want to do, some that are less relevant. And I think what I learned was that you just have to take as much as you can out of every job and learn from as many people as you can. And then finally, I went to San Francisco to do a fellowship for 2 years before getting a consultant job, luckily, at the Royal London. So for me, I think advice-wise, in terms of choosing what you want to do, I think it's slightly harder now because you do have to have some idea earlier. But I do think that by the time you get to choosing training jobs, the idea is that you should try and get as broad an experience as you can, whether it's on the job or outside of the job, with things that you might be interested in. And I would suggest choosing things that are likely to interest you for a long period of time, not necessarily what is exciting or maybe even easy for you to do at the stage that you are at. As advice, again, I would tend to choose a disease area or specialty area over a technique. So I think, choosing to work in trauma surgery or trauma care, as I have done, or I don't know, urological cancer or lung cancer, facial reconstruction, is probably more valuable than choosing a technique that interests you, like a specific surgical procedure or endovascular approaches or robotic or minimally invasive approaches, only because you then become defined by that technique. And of course, techniques change and evolve, and you may find yourself becoming superseded, whereas the disease will always be there and the patients will always be there, and it's the approach to those patients that's so important. So I think in general, what's going to interest you and what's going to interest you in terms of the disease area, rather than what specifically you're going to do and where you might be going to do that. And I think that probably applies to the idea of being a surgeon as well. Being a surgeon is not specifically about picking up a scalpel and forceps and scissors and doing something technical, although of course that's what in many ways defines us. But most surgeons do not spend all their time operating. Most surgeons will spend a fraction of their time operating and a lot of time looking after patients in one way or another. And I think you need to be comfortable in the looking after patients bit, and comfortable and interested in the looking after patients bit, not only in the bit that involves operating, because I think you will again become dissatisfied if that is if what the goal is. Not to say that surgery isn't exciting and super rewarding as a technical skill itself, especially in my, or I think especially in my area, because you're doing very, very complex, time critical surgery at moments which are life and death, or life changing versus not life changing for patients, and that in itself is obviously very rewarding, but comes with the downside of when things don't turn out as well as they might do, and there are heavinesses to being a surgeon, as there are with being other doctors, that are different, I think, for being a surgeon, because it is very, very focused on the individual, rather than the team and the wider approach as it can be with other specialties. In terms of how I actually became a surgeon, I don't feel that I'm a natural surgeon. You see some people who are naturally gifted, or appear to be naturally gifted at operating. I definitely was not naturally gifted at operating, and I had to learn how to be a surgeon, and actually be told that I had to learn how to be a surgeon, rather than thinking that it was something that would just come over time. And I think there's a huge advantage to having the right teachers, and teachers who will take you back to really learning the basics well, how to hold a needle holder, how to stitch properly. It's so important that you get the basics down right, and you can learn and improve these throughout your career, whether on a patient or on simulators. I think you need to learn the exposures that you will need, and you need to learn to do them well under all sorts of conditions, how to choose which exposure to do, how to do it to its utmost, so that exposure is almost everything. And then understand the procedure that you're going to do, not just in a series of technical steps one after the other, but also which bits are the challenging steps, which bits are things that might go wrong, and if they do go wrong, how do you get yourself out of trouble? And so it's constantly watching, learning, seeing where others get into trouble and how they get out of trouble. And the other thing that's critical, I think, especially in the acute surgical specialties, is that situational awareness, that you're not focused on your hands and what's going on immediately in front of you, but you're focused on the whole patient and the entire team around you, and you know what's happening, and you're tailoring what you do to that team, and that you're involving the team in the whole piece. Because more and more now, of course, surgery is not an individual's approach, it's about the entire team. So being a surgeon is not straightforward. You don't just drift through your training and get osmotically surgical insight seeping into your body. I think it has to be an active process, and the sooner that you realize that's an active process, the better. And it does require you to be a good doctor primarily. It requires you to be a good physician, because this is about not just the technical aspects, but how you manage complications both intraoperatively and postoperatively. You have to be a good physician, and that sadly means that you need solid understanding of physiology, pathophysiology, anatomy, all the things that you wonder why you're learning for surgical exams or any exam, and you actually need to know it if you're going to have that fundamental strong base underneath you. I think to be a master surgeon, it's really about that, being a master of contingency. You have to understand all the possible ways that something can go wrong, and you have to know all the possible ways of getting out of trouble. I'm pretty much at the stage now where I know that no matter what happens in an operation or not, what somebody may or may not do or how tissues may or may not respond, if it's fixable, I can pretty much fix it. But I know that it's taken a long time of active learning and thought to get there. I think being a surgeon also comes with a lot of responsibility, obviously to your patients, but you have a responsibility very much to your community. You're a figurehead in your hospital, in your specialty, but also in your local population, in your own community, and how you act and behave and what you advocate for becomes very important throughout your career. But I think actually, having said all of that, if I'm called in at 2 o'clock in the morning, I still enjoy being called in at 2 o'clock in the morning, and I find it the purest form of why I chose to be a doctor and why I chose to be a surgeon. It's not emails, it's not meetings, it's not management or anything. It's me and the team trying to look after a patient who needs immediate attention. Yeah, I think that's the purest form of why we do what we do, and what I was trained to do and what I chose to do. And then just finally, I think the role of being a surgeon scientist. So again, I never considered myself as an academic. I did not do a PhD, but I did always consider research as part of being a doctor. So I always did bits and pieces, whether it was audit or extended audits or actual research, and always took the opportunity to do that. And just having done that and continuing to do that, I think you end up making your own luck. I was very lucky in terms of one of the pieces of research that I did into coagulopathy essentially put me on a springboard to the career that I am now. But it was also about, that was one of a large number of projects that I had done, and also continuing to work in that when I could have just discarded it and moved on to the next thing. So in many ways, you make your own luck, but you also, persistence and commitment and thought are important. And I think, whether you're a formal academic or whether you're a surgeon working with a clinical job, having the mind of a scientist is important for the patients in front of you. But I think there is something specifically rewarding about continuing to do research, and it's become a bigger and bigger part of my career, obviously. So as a junior, my suggestion would be, please say yes to every opportunity that you can take on. Don't take on things that you can't complete, because there's nothing worse than not completing because you may as well never have done it. But if you can do it and you can complete it, all of these things are valuable experience, whether something comes of them or not. And one of them will prove to be the fruits of things in the future. But it's so important for us to have surgeon scientists who can push both the disease area with a surgical view and also push the science of surgery forwards. So that's it, I think, in a nutshell. Some people know that they're going to be surgeons from the minute that they were born, or it seems that way. That wasn't my experience. It is not easy being a surgeon or becoming a surgeon, but it is very rewarding, and I wish you all the best of luck on your path towards that. Bye-bye.